Intravenous insertion. For breast cancer, I asked the patient which part of her breast had cancer. And she answered it was the left side. So I avoided her left arm and hand. Here's why. The primary reason why healthcare professionals often avoid inserting fours intravenous lines or performing blood draws on the affected side of a patient with breast cancer is to minimize the risk of lymphedema. Here's a more detailed explanation. Lymphedema risk. Breast cancer surgery, especially when it involves the removal of axillary underarm lymph nodes, can disrupt the lymphatic system in the affected arm. Radiation therapy to the chest or underarm area can also damage lymph nodes and vessels. The lymphatic system is responsible for draining fluid from the tissues. Damage or removal of lymph nodes can impair this drainage, leading to a buildup of fluid in the arm, hand, breast, or chest wall on the affected side. This is lymphedema. Lymphedema is a chronic condition that can cause swelling, pain, heaviness, and an increased risk of infection. Why avoid procedures on the affected side? Increased risk of injury and infection. Any skin puncture, such as that from an IV insertion or blood draw, carries a small risk of injury and infection. In the affected limb, the impaired lymphatic drainage makes it harder for the body to fight off infection. An infection in the affected arm can potentially trigger or worsen lymphedema. Potential for further lymphatic damage. Although the evidence is still being researched, there's a theoretical concern that repeated punctures on the affected side could potentially cause further damage to the already compromised lymphatic vessels. Recommendations and considerations. Historically, there has been a strong recommendation to avoid any procedures on the affected side. Many healthcare providers and institutions have strict policies regarding this. Recent research has started to question the absolute contraindication. Some studies suggest that the risk of lymphedema from a single clean IV insertion or blood draw on the affected side might be very low, especially with proper technique and precautions. If the unaffected arm has limited or unsuitable veins, and the affected arm must be used, strict aseptic techniques and careful monitoring are essential to minimize the risk of infection. In summary, the primary concern is to protect the affected limb from potential injury and infection, which could increase the risk of developing or worsening lymphedema after breast cancer treatment, while the absolute contraindication is being re-evaluated. Erring on the side of caution and using the unaffected arm remains a common practice. Always discuss specific concerns and the need for access with the patient's oncologist and healthcare team. They can assess the individual risks and benefits based on the patient's specific situation. Thank you for watching. Like, follow, and share for more.